Hi everyone, I'm just going to wait for more people to come on and I'm going to invite Dr. Terry Wahls on with us right now. Hi, nice seeing you guys. Hi, it is so nice to see you.
Hey, how are you?
I'm doing amazing. I hope you're having a great day so
I
far.
am. You're my third interview today.
Oh, wow. A whole long day. I'm glad for you to be here. I just want to introduce you for anyone that doesn't know you. I know there are still people popping on, but this is Dr. Terry Wahls, the creator of the Wahls Protocol, after being diagnosed with MS herself and was able to transform her whole diagnosis through diet and lifestyle. And for me, I feel like your example continues to inspire me. I was diagnosed with MS myself when I was only 15 years old. That was 10 years ago now. But ever since then, I have been able to feel the healing effects of diet and lifestyle. It's personally my mission to tell other people and show other people what power our own foods have, what power our own thoughts and lifestyle habits have on us. And for me, I just want to hear more about your story and your research. And I know that you suffered with MS and trigeminal neuralgia. Can you tell us more about that?
Sure. So I'm an internal medicine physician, a very conventional internal medicine doc. In 2000, I was diagnosed with relapsing remitting MS. I did my research. I found the best MS center, saw their best physician, took the newest drugs. And still within 3 years, I'm in a tilt recline wheelchair. And I've already had 23 years of worsening trigeminal neuralgia. And that's when I decided to go back to reading the basic science. I decided that mitochondrial dysfunction is what drives disability. And I create a supplement cocktail for my mitochondria. It helps a little bit. And I'm very grateful. I discovered the Institute for Functional Medicine. They have a course on neuroprotection. I have a longer list of supplements that I add. I also discover a study using electrical stimulation of muscles, and I add that to my physical therapy routine. Then I have this big aha,
Yeah.
like what if I redesign the paleo diet that I've already been on for 5 years
Yeah.
based on this list of
Yeah.
supplements. So that's more research to figure out where these foods are in the food supply. And I start this new way of eating in December of 2007.
Nice.
Now, I've already been doing the electrical stimulation for muscles for about 3 months. And at that point, I'm so weak I cannot sit up in a regular chair more than 10 minutes, which for your audience, that meets the definition of being bedridden.
Mm-hmm.
I'm beginning to have brain fog, and my trigeminal neuralgia has been getting relentlessly worse for 27 years. So it's very clear I'm on path to become bedridden by my illness, probably demented by my illness, and probably die with intractable pain. I'm doing all that I can with supplements, with my electrical stimulation muscles, and with this newly redesigned paleo diet. And I'm doing that because my hands still work.
Yeah.
And being able to feed yourself and wipe your own butt is really valuable.
Yeah, definitely.
You might lose that. So I'm doing a lot to try and hang on to what I've got. And so I start this new way of eating December 26th. And by the end of January, my physical therapist says, Terry, you're definitely stronger. And he advances my exercises. I can now exercise 10 minutes in the morning and 10 minutes in the evening. Mm-hmm. And I tell Jackie I'd like to try sitting up in a regular chair for supper. First time in years. Yeah. And that's huge.
It is huge.
And so we're at advancing my exercises. I'm adding some e-stim during the day while I'm at work. And in March, I start walking with walking sticks.
Nice.
In the hospital. My partners are all stunned. And then pretty soon I'm walking with one walking stick and then with none. And then on Mother's Day, I tell Jackie that I want to try riding my bike which I've not done in 6 years. And we have this emergency family meeting. She tells my big 16-year-old son, who's 6'5", Zach, you run alongside in the left. Mm-hmm. She tells my daughter, who's 13, you run alongside in the right, and she'll follow. We get in a position and get on my bike, and I bike around the block. The big 16-year-old boy, he's crying. The 13-year-old girl, Zeb, she's crying. Jackie's crying. And when I relive that moment, I still cry. Yeah. Because, you know, how much recovery might be possible. And so after that, every day I biked a little bit more. And then in October, Jackie said, honey, I've signed you up for the Courage Run. It's 18.5 miles. However far you go will be fine. It'll be a triumph. And so, you know, we get on the bikes, and I have to take a couple of rests, but I cross that finish line. And once again, we're all crying. My kids are crying, Jackie's crying, I'm crying. And it fundamentally changes how I think about disease and health. It will change the way I practice medicine, and it will change the focus of the research that I do. And I've since made it my mission to change the standard of care so that when people are diagnosed with MS, that yes, we may be told that there are disease-modifying drug treatments that have been approved that reduce the number of enhancing lesions, but just as important, you must also improve your diet, improve your sleep, have a stress-reducing practice, and exercise. It takes 30 years to change that standard of care. I'm 15 years into this journey. My idea is that we're so condemned as dangerous in 2009, when I first started talking about my amazing recovery. Now, when I go to, our team goes to our scientific meetings and we're presenting our research, and when I'm walking around at the clinical meetings for MS care, my colleagues, my neurology colleagues, are stopping me to ask a few questions and then saying, "Good," and they hand their phone to their partner, the people with them, saying, "Could you get a picture of Dr. Wahls and me? Because my people would really like to see that."
Exactly. I will say I was diagnosed in 2013, and I have clients now because I went through your program for practitioners. And I will say the way neurologists treated me compared to how neurologists are treating them now, it's night and day difference. Like, things are changing, and I'm seeing it change. I truly just feel like you're an example that continues to inspire. As I said before, it's amazing the work that you're putting out there and showing.
The the concept, when we first started going to these scientific meetings, I was the only one having any posters about diet and quality of life for MS. Now there are many more scientists that are studying this. Now the idea that diet really matters is being accepted. Now we're beginning to understand the molecules involved. And now it's also super interesting that I'm heralded as the woman who led the way. And really, it was Dr. Roy Swank who first said diet really matters, and he was condemned because he told the public as well. And I was condemned because I told the public as well. But now people are saying Roy Swank was brilliant, and they're also saying Wahls was brilliant. And we have to thank her for leading the way in doing the dietary research and teaching the other scientists how to do dietary research for people with MS.
Yeah, and it's truly amazing the changes we're all seeing. And can you just tell us more about your clinical research?
Yeah.
What are the impactful results you found?
So everyone who's listening, first, if you have multiple sclerosis, relapsing remitting MS, or even, if you have MS, please sign up at terrywahls.com/MS study and be part of our patient registry, because we send links out because we do have some survey-based only studies that we do as well. And then for people with relapsing remitting MS, between the ages of 18 and 70, we have a clinical trial comparing a ketogenic diet to a paleo diet to a usual diet. We'll follow people for 2 whole years, and we'll have patient-reported outcomes on mood, quality of life, clinical outcomes on walking, hand function, vision function, and brain structure with a no contrast MRI at baseline and at month 24. This will be one of the largest studies because we're recruiting 156 people. We will follow them for 2 years, so it'll be the largest, longest that has MRI data. I'm very excited. We've got, I think, 116 people randomized. We have to recruit 156. So we will have room for about 40 more. I'm hoping you, and I see there are 17 other people in here, so sign up, be part of my database so you can be here for future studies. And please consider being part of this study. If you're in the intervention arm, the key thing is you have to have relapsing remitting MS and you have to be willing to be randomized, so that if you are already following the paleo diet, for example, you're like, you know, I love that. If you're going to be randomized such that if you're randomized to the keto arm, that you're willing to do the keto diet. If you're already on a keto diet, you have to be willing to be randomized so that if you're randomized to the paleo arm, you will do the paleo diet. And then if you're in the usual arm, you get to keep eating whatever it is that you want to do. If you're a vegetarian or vegan, that's okay, but you have to be willing to be randomized and then be willing to follow the diet to which you are assigned.
And can you say again how long they're going to have to follow that diet?
So it'll be 2 years.
2 years.
And, you know, this is a real world study. So if, you know, life happens and you follow the diet really great for 15 months and then something happens and you quit following the diet, we don't kick you out. We keep you in the study. We'll help you get back into the diet when you're ready. And that we just want to have what your real world experience is. Yeah. And the other thing that I think is really quite remarkable, so we've been, I have to plug in here. We're getting low on our power. There we go. So what I sort of lost my train of thought there.
You're totally fine. I do have a follow-up question.
Oh,
if that's
yeah,
okay.
Go right ahead.
Can you just tell us how diet studies differ from like drug studies?
Oh, yeah.
Is there?
So a drug study, we're going to ask you to either take an infusion, an injection, or some medication by mouth. And then some people will get the active ingredient and others will get a fake ingredient that's also called the placebo. So it's inactive. And neither the patient nor the study team knows, and the statisticians don't know. They just know group 1 and group 2. When you do a diet study, people who are eating the food know what food they're eating. So they know I'm in the intervention diet 1 or intervention diet 2, or I'm in the control diet. And furthermore, changing what we eat is hard. Giving up foods to which you may be addicted is hard. Learning new recipes, learning how to shop, learning how to find those ingredients is hard. Learning the food swaps for, you know, the foods that my family loves to eat. I need to figure out how to make those familiar recipes using slightly different ingredients. That's hard.
It definitely is. Is that going to be guided and helped through this study as well? Okay,
so in
awesome.
The intervention arm, we have dietitians that help you figure out those food swaps. We have some recipe apps to help you find recipes that are compatible for the 2 intervention diets. And then in the control arm, in the usual diet arm, we give tips every month with strategies to improve the quality of your diet. And I know that people in diet studies, particularly diet studies, and this has been my experience thus far, is they want to improve their diets. And so they're not going to be eating the standard American diet. They're going to be eating a better diet. And they will probably implement many of those things I tell them to implement every month. So in fact, I'm very confident that all three groups are going to improve.
Yeah. And do you feel like there's a way to help conflict of interest in
Oh,
research?
so, people have said, like, I don't trust your research, Dr. Wahls, because you're investigating the Wahls diet.
Mhm.
Well, the university and I both agree that it's vital that I do high quality research. And so I tell the university then there's a potential perceived conflict of interest. The University of Iowa Conflict of Interest Management Plan then outlines a strategy to make sure conflict of interest is managed. In my case, what we do is I don't consent people. I do not have any access to any of the data. And the statistician who does the statistics does not know who is assigned to which group. There's group 1, 2, and 3.
Okay.
And so he'll do all of the statistical analyses masked to group assignment. And he will write the report to the Data Safety Monitoring Board saying, here are my findings. Group 1 and group 3 had the best outcomes, and their equivalent group 1 and 3 are not different between the two, and definitely improved over time. Group 2 improved, but not as much as group 3, or that they all three improved a remarkable degree. And by the way, we could tell that groups 1 and 3 were the two intervention diets, and that the people in group 2 were pretty evenly split. Looks like what they did was they chose to follow, about 2/3 followed the paleo diet, 1/3, a sixth followed the keto diet, and 1/6 actually followed what looks like the standard American diet. So we're doing some people doing diet questionnaires so we know which diet they're following, and are they even in the control group, which dietary pattern they're following, because it'll be important for us to sort that out at the end. Did people follow the diets which they were assigned? Did they abandon it for whatever reason?
Makes complete sense. And I'm really curious to know, do you ever expect scientists will find a drug that helps regrow myelin?
Well, we have a lot of drugs that regrow myelin in rats very well, and in mice very well. But when we test those drugs in people, so far they've all failed, or they have just a very, very small effect. And part of that, the reason for that is in rats and mice, we control the diet very precisely. They get their drug, and we control their sleep, their light, and all of the environment very well. If we're in a drug study for myelin, you and I get to eat what we want. We get to have fights with our family or at work. We stay up all night or not. We drink alcohol or not. We have a loving relationship with our spouse or not.
Yeah.
And so
much variability.
There's so much variability. And if we control all of the environmental factors, then you have a different outcome. So I just ran a course on remyelination. We go over those. It's a wonderful course. You can still have that on my website. The myelination is still available. In November, we'll have another course on restoring function, which builds on that talks about the various types of rehabilitation programs and devices and interventions that can, once you have stopped the damage, create a better environment to repair your myelin, and you can now rebuild your sensory nerves, rebuild your muscle strength, your coordination. And that'll be November 13th and 14th.
I love everything you're saying. I feel like just living it throughout my own life, like the answers are so simple. Even though they're tough to do, they're so simple to do. And I feel like sometimes we need that extra oomph, like going through a course, understanding fully why we're doing this. And I feel like, at least for me, I got more inspired why I knew I was doing this and the research behind it.
We have to understand why.
Yeah, definitely.
We have to understand the mechanisms of how it's possible that changing our diet could matter, how it's possible that these devices might work, how it's possible that this targeted supplement may further support, and how it's possible that, because there are a lot of different devices that we can elect to obtain according to your financial means that can help all of that.
Yeah. Just to transition a bit, I have a couple more questions for like your research.
Yes.
Can you tell us how microglia and astrocytes shift into repair mode?
Yeah. So my brain has really 4 big cell types. The neurons that do the work of thinking, perceiving senses, initiating motor movement. The microglia that inspect, and they're the immune cells that will protect me from threats, mop up the damage. The astrocytes that nourish my neurons, those are the cells that take the nutrients from the blood vessels into my brain. If my microglia perceive a threat, they will go in attack mode, and they'll call in other immune cells to mop up the damage, kill the viruses, kill the bacteria. And if they see that all the damage has been mopped up and is gone, all of the pathogens, that is the infecting microbes, are gone, then they'll call in different cells to come do the repair work. Therefore, we need the microglia and the astrocytes to protect us and to supervise the cleanup work. You think of it like after a tornado comes through and the houses are all wrecked here. You have to call in the demolition crew to clean up the damage. When that's all cleaned up, then you call in a different crew, the rebuilding crew, that does, reframes the houses and puts them all back up. That's what our brain cells have to do. They have to clean out the damage and then rebuild after the damage is all cleaned out.
Can diet and lifestyle help us with our
all that stuff
and astrocytes as well?
Absolutely. And that's why I think the drugs are all going to fail. So that's why, and there are probably about 20 different drugs that have worked very well in tissue culture. There are 8 drugs that have been tested that work well in rodents. None of them have worked well in humans. They have, at best, a trivial amount of improvement that's not clinically meaningful. I don't think they'll ever work in humans because you have to take care of the microglia. You have to do all the modifiable lifestyle stuff. And that's what I teach. That's what we are so effective at in my clinical trials, in our clinical course. That's what I teach my practitioners to do. And I would predict that those compounds that work well in rats would work well for the Wahls Protocol patient.
I would believe so too, 100%.
Yeah.
100%.
So in my remyelination course, I run through this. What's so exciting in the rats and the mice, and how they failed in humans, and then I go through in the natural products research that use the same molecular mechanisms that the drug studies do, and I say, you know what? Here are the supplements using the same mechanisms, work well in rats, that would also by themselves fail in humans.
Yeah.
But if you added them to a Wahls Protocol diet and lifestyle and these targeted supplements, I think it would be very helpful. And so that's why, again, to everyone who's listening, I encourage you to go check out the remyelination, the advanced remyelination courses. I think you would have, feel like you have tools that will help support your goals of repairing your cranial nerves, your optic nerve if vision's an issue, your cranial spinal cord, and your peripheral nerves, for those of you who have peripheral nerve damage.
Exactly. So is that your actionable step for anyone living with MS, what they can start doing right now, heading over to that course to remyelinate?
Yeah, the first thing I really encourage you to do is to do the remyelination course or the advanced remyelination course. It's really marvelous. This Friday, particularly for anyone who's a practitioner, a health coach, a therapist, physician, chiropractor, or if you're a health enthusiast who you're pretty knowledgeable about these concepts, sign up and be part of Amplify. That's a free event. It will happen on Friday, and it's from 9 until 2:30. If you already got stuff to do on Friday because your life is busy, sign up anyway because you'll get a chance to look at the replay over the weekend.
Nice. I will try my best to be there. So I feel like diet and lifestyle can completely be a whole game changer. And can you give any...
Is it better to not take drugs? So what I'm saying is talk to your medical team about the disease-modifying drugs that are best for you. What your medical team probably does not know anything about is diet and lifestyle that can support how your cells do the biology of life. So at the very least, eat less added sugar, less processed food, eat more of these radical things our grandmothers have called non-starchy vegetables. And be sure you have plenty of protein, sleep, exercise. You can get more details on my website. And we have many, many more resources at terrywahls.com.
I'll be sure to share it with my whole audience. Just your website, your course, and everything you've got going on, and your new research. Because I want to make sure anyone that can get a part of your research has the chance to too.
Yes, we've got room for 40 more, and we would love to get everybody in your tribe into our study.
Yes. That'd be so amazing. So my last question is there any information or advice you have for loved ones of those living with MS?
Do this together. If we adopt a better diet together, if we adopt stress-reducing practices together, whether it's meditation or mindfulness or time in nature together, if we do our walks and exercise together, it's so much easier to be successful. If we think that my loved one is going to eat the Wahls diet and I'm going to keep eating the standard American diet and having pizza and beer on the weekends, it's not supportive. It's not loving. And it's not that you can't have pizza and beer if you want. Just please don't do it in front of your loved one. You can decide, you know what, at home we're going to eat the Wahls Protocol. And on Friday I'd like to go out with my friends. So why don't you have your friends in and you can cook out. Lovely.
Yeah.
And I will go out with my friends and eat pizza and beer, and I promise I will brush my teeth before I go home, so I smell on my breath, and I will not talk about it.
And I feel like the support system is a whole game changer when you start switching your own diet, because you know it's helping yourself, but when there's pizza, when there's your favorite foods right in front of you, and like your loved one is
mouth, and you'll be chewing before you know it.
Yeah, exactly. It makes it so much harder. But it's such a blessing for me to have people around me that have been able to, at least in the house, support me and do the same diet and lifestyle that I can, because they see it. What a game changer this all is.
And for many families, they'll say like, okay, I can do this, my husband can do this, or my wife can do this, but I just can't, I don't want to deprive my children of this. Yeah. So my response there is, are children at higher risk for mental health problems, for cancers, for autoimmune issues because of the standard American diet? If you have the whole family on the Wahls diet, then you're reducing the mental health problems, the autoimmune issues, and the cancer risk for the whole family, including your children. Because most of us want our children to thrive, to do really well.
And it's exactly that. At least for my husband, he is healthy as he can be, but switching to my diet, he just feels so much more alive. The brain fog starts going away. I'm like, this is just so beneficial, not only for the people that have health issues or potentially going to have health issues, but for the people that are healthy, quote unquote healthy, you can just feel so much better.
Well, they discover that their mental clarity's improved, that those headaches they've been getting gone away, that their blood pressure improved, that they no longer need the blood pressure medications, and that, you know, the migraines I used to get a couple times a month, those are gone, or that my severe periods have gone, or another thing that has happened, we've had a number of women who wanted so much to have children and were unable to have conceived. They were told that they were infertile, and they got pregnant. In fact, I needed to revise my study consent because we had 3 unplanned pregnancies. Now, fortunately, one in each group by, you know, all 3 of the study arms. And so our new consent says, if you improve the quality of your diet, you may have increased fertility. Even if you've been told that you are infertile, please start using birth control for the duration that you're in the study. And if that's for the whole family, so if the husband is the study participant, we're asking him and his wife to use contraception because we want this to be a family prevention. So he needs to know that he's going to be more fertile, she will be more fertile, and what probably really scares them all is your kids will be more fertile.
Oh, but it's just so it's astounding what food can do for us, and it's just like the simple everyday things too.
Simple thing, you know. And I do want to comment on one of the questions I saw go by. Yes. Is there a higher cancer risk for people with MS and autoimmunity? The answer is yes. Just having the autoimmune disease, we know our immune cells appear to be not functioning normally, and there is a higher rate of cancer. We also know that many of the drugs that we take for our autoimmune disease make us more vulnerable for infection and more vulnerable for cancers. I want you to talk to your medical team about that. Certainly one of the best things you can do is eat a lower carb diet, get rid of the added sugar, get rid of the processed food, eat more of these radical things known as vegetables. I think the Wahls Protocol would be helpful. But again, talk to your medical team. It is part of having the autoimmune diagnosis and part of the side effect risks of taking these disease-modifying drugs, which do lower the risk of new enhancing lesions. So I'm not anti-drug. I want you to talk to your medical team and sort out what is right for you. But I'm very pro better diet, stress reduction, better sleep, more exercise.
Exactly. Thank you so much, Dr. Wahls, for your time. I know we went a little past time, but I'm so grateful for you to be here and share all of your knowledge with us and your stuff coming up.
Thank you so much. Everybody, be sure and sign up for Amplify. I'd love to see you on Friday. Sign up for our patient list at terrywahls.com/MS study so that you can be on our mailing list so we can tell you about our next clinical trial as well.
Awesome. Thank you so much. And you have an amazing Halloween. Enjoy your day.
Thank you so much.
Thank you. Bye.
Bye-bye.